say that facts are what matters, and keeping yourselves and your families up to date is more important now than ever, and will continue to be so as we start to make a lot of changes and announcements in the coming weeks related to getting our lives back to a semblance of normalcy and getting back to work. Tomorrow, this press conference will be at 2:30, and then we'll be returning to the usual 1 o'clock time on Thursday and Friday, and then taking a break for the weekend. To those of you at home, you can see we're no longer in the stateroom. Today, we are at the Vets Auditorium in Providence. This was an attempt to allow the media into the room, but in a socially distanced and safe way. I want to begin today by thanking the folks at PPAC who've worked very hard to enable us to do this and who are graciously offering us this space. I want to thank Lynn Singleton, who runs the Vets. He's been a fantastic partner and is doing a great job to help us. I want to thank the hardworking men and women from the Alliance of Theatrical Stage Employees who staff this gorgeous facility and are helping us out. Rhode Island sheriffs who are here screening folks as they walk in to make sure there's nobody here with symptoms. And the cleaning crew, the state's cleaning crew from the Department of Administration, who are here sanitizing in the morning and in the night. So I want to thank all of you for playing a role, and thank you to the press for going along with this new system. I highlight all that because it's going to take some adjustments. In fact, hopefully today looks better than yesterday. Yesterday was our first day. We heard, there were some glitches. It was a little fuzzy on TV. Hopefully today it's a little bit better. Tomorrow will be even better. This is what life is going to be like for us for a while. We are going to be living with this virus probably for a year, hopefully less, but until we have a vaccine that's widely available, or a therapy that is highly effective and widely available, which means we're going to have to change the way we do things, be flexible, and come up with innovations in order to get us through and allow us to continue to do our business. So we'll begin like we always do with the data. The data is on the screen. As you can see, it's a good data story. You see a continued plateau. We have 164 new cases. It's about flat. I mean, you'll see we did fewer tests Sunday and Monday. So we're not seeing a decline, which is what we hope to eventually get to, but it's very steady. It's a steady picture and a plateau. We're seeing a decline in the hospitalization rates and in ICUs. That's excellent. And very sadly, in addition to the 164 new cases, we do have another 14 deaths. And as the deaths mount, it's important that all of us take a minute to remember those who've lost loved ones and just think for a second of the toll that this virus has taken on so many Rhode Island families. As we go forward, it's important that we do whatever we need to do in order to accept that this is the new way of living, not try to fight against the new regulations, and not allow ourselves to get too frustrated. And that's not going to be easy. I know that isn't going to be easy. But the truth of it is, if we try to just go back to the old way of doing things, we're going to get into trouble. Too many people will get sick. We'll see that incline again, and we'll have to do what we've seen in other countries that went too quickly in Hong Kong, in Singapore, and other places, and they had to pull back. And it is my goal, I am managing this in such a way with the #1 goal of never having to reopen this economy again. I want to go slowly and never have to pull back. And what we know, and why people say, why is it so important to go slow? Here's why it's so important to go slow. What we are doing now is going to show up in our cases 2 weeks from now. So if over the weekend, lots of people got together in big family gatherings, or if in this week, when the stay-at-home order is lifted, and we start to push the limits, crowd into retail shops, get out there sooner than we should, get out in the parks and play contact sports with a lot of people, 2 weeks from now, we'll see cases go up, deaths go up, hospitalizations go up. And then, if they go up too much, at that point, we'll have to pull back. So the reality is there is no hiding from this thing. We cannot outrun the virus, and we can't hide from it. So try your best to live within the new rules, to stick with us over the next few weeks as we reopen in a slow and steady pattern. Because if we do that, then we can slowly and steadily open up and get to a place where we're all back to work. But if we push it too fast in the beginning, we'll overwhelm the system again, and we'll wind up right where we started. So, having said that, I just want to remind you, the gathering limit for social gatherings is 5 people. So what does that mean? And it shouldn't be a different 5 people every day. Stay close to home and keep your social network small. Keep your social network small in this phase. This phase won't last forever. It's weeks, not months. Hang in there with me for a couple more weeks. It will make a difference. There shouldn't be, barbecues, parties, house parties, big family gatherings. If you want to go shopping, that's great. Retail stores are open. Keep your distance, wear your mask, wash your hands, wait in line 6 feet apart. I will say this. People are asking me, how's it going 4 days into lifting our stay-at-home order? I'm very pleased with how it's going. I'm very pleased. We're seeing, by and large, people following rules, by and large, people using the parks but doing it responsibly. Most people are wearing their masks when they're at retail. Nearly everyone working in a retail operation is wearing their mask. And so that gives me confidence. The longer we see Rhode Islanders following the rules, then I have confidence that we can continue to relax the rules as we go forward. I do want to make a special note about hospitals, healthcare workers, and doctors' offices. So as I've said, in this first phase, the focus is getting people back to work. I want to keep a lid on social gatherings. That's why we kept a limit at 5. But we want to get folks back to work. And we are particularly focused in phase 1 on retail, and that's going very well, and healthcare. A lot of people are out of work in healthcare. Hospitals pulled back on all of their non-emergency procedures and non-critical surgeries. A lot of Rhode Islanders have been delaying on the healthcare that they feel they need, delaying on going to see their doctor, going to get that test, going to get that immunization. We've heard from the hospitals this week, hospitals are back up and running for non-critical surgery, procedures, and appointments. Here's what I want you to know if you're a Rhode Islander who has delayed a procedure or a test or a surgery. It's safe to go back. We're hearing from hospitals and large physician practices that patients are still afraid. The doctors are there, the hospitals are ready, they're doing more testing, more cleaning, more social distancing, more quarantining, more infection control, but patients are still afraid. So today, I want to say to the Rhode Islanders who are out there, I want you to have confidence. We wouldn't be allowing this if it weren't safe. These hospitals know what they're doing, they're safe, they are open for business, they're taking it slowly, they are ready to serve you. And if anything, if you've been delaying your health care for the past couple of months, it is time for you to muster the courage to go ahead and schedule that appointment. So if you get a call from a hospital, if it's time to reschedule an appointment or a surgery or a test, go ahead and do it. Go ahead and do it. I know you're anxious. I know you're anxious. But in this stage 1, we're going to walk before we run. We're taking it slowly. They are ready. They are safe. And I'm encouraging you to go ahead and get that health care that you've put off for the past 8 weeks. I'm going to fly through a handful of different topics, just tick through some of the important things. I want to hit again on the contact tracing diary. So I have been asking everyone in Rhode Island to create a diary. If you haven't done it, it's not too late. Do it. Start it now. Start it today. Start it tonight. If you have one, great. As we reopen the economy, you're going to go out more. You're going to leave your house more. You might go to the park. You might go to a shop. Next week, you might go out for dinner outside. You might be popping into the office to pick up some papers, and you might run into a colleague. So you're going to be seeing more people. That means these contact tracing notebooks are going to become more and more important. Eventually, we're going to, as I have said, we hope to get this to be more tech-enabled. We hope that your phone, if you choose to opt in, will be able to ping other phones that you come into contact with. But we're still a little bit away from that. And right now, the best thing you can do, everybody, it's very simple. It takes about 30 seconds at the end of the night. Just write down who you were with and where you were. Some people have said to me, well, Gov, I went to go pick up food at a restaurant. I saw some people. I didn't know who they were. Well, I know you can't write that down, but then write down where you were, what time you were at that restaurant, and what restaurant you were at. If you get sick, you will get tested. If you're tested positive, you will quickly be called by someone at the Department of Health. They're going to ask you to take out your contact tracing notebook so they can ask you who you've been in contact with so we can go test those contacts or put them into quarantine. So I know this sounds simple. This will save lives. This whole disease is about limiting your network and allowing us to pinpoint where the problems are. So please, just stick with it. Stick with it. I do it every night. Sometimes I forget, and then I go back the next day and make up for yesterday. So please, if everyone can do it, it will really help us enormously. And frankly, it'll allow us to keep opening the economy. Here's the deal. The more you follow the rules, the more and faster we can open the economy. The more people push the rules and don't follow the rules, the slower we have to go. So contact tracing diaries, a lot of people have said, do they still matter? I've been getting that question a lot. So the short answer is, not only do they still matter, they matter now more than ever because you're going to be seeing more people. I wanted to take a minute to talk about the workforce stabilization efforts that we have had underway. Obviously, you see every day in Rhode Island and frankly in every other state in America, this crisis has hit hardest in communal living environments, what we call congregate care environments, particularly congregate care healthcare settings, nursing homes, the veterans home, group homes, homes for the developmentally disabled, any areas where you have groups of people in close proximity and those people are themselves sick or frail or otherwise physically compromised, that's where the virus thrives. Those are also the hardest places to work. And they're open 24/7. They're very stressful. And this has been an unbelievably difficult time on our frontline workers in those settings. As a result, in an attempt to respond to that need, I think 2 weeks ago I announced a congregate care workforce stabilization fund. It was an effort to provide wage increases to low-wage frontline workers. So the custodian, food preparer, nurse's assistant in a nursing home, folks making $15, $16 an hour in very stressful conditions. We got that up and running quickly. We have put that money out the door. Folks have said, what's the status? So today I'm proud to share that we've committed more than $8.2 million in additional wages to these frontline workers. So this is a $8 million raise into the pockets of some of our hardest working, lowest paid folks who've been on the front lines literally every day, 7 days a week for the past 8 weeks. More than $6 million of that is already out the door, and the other $2 million should be out hopefully this week. This funding is expected to benefit more than 10,000 workers at more than 160 facilities. as I say, all folks who make less $20 an hour or less. This is a temporary measure. It's set to expire June 1st. The intent, this is not perfect in any way. As I've said from the beginning, no program we're rolling out is perfect, but it was an attempt to help stabilize that workforce and get us through until June 1st, hopefully the worst part of the crisis. Another, I suppose, piece of good news for nursing homes. We heard yesterday that the federal government, FEMA, is going to be sending a limited amount of personal protective equipment directly to nursing homes. They say they'll be starting that next week. So if you're a nursing home worker or administrator out there, this is welcome news. This is good news. We at the state are going to continue to do everything we are doing, and we are every week able to push out more PPE and more surgical masks. On top of that, the federal government is going to send you once a week, every week for the next 4 to 5 weeks, a specific supply of PPE for your workers in nursing homes. So it's a little bit of good news. Okay, I want to talk about two other things. I want to talk about distance learning for a second. The reports from distance learning continue to be, by and large, very positive. Attendance is high, engagement is high, teachers are working probably harder than they've ever worked, and students are really leaning in and engaging. There are challenges, for sure. There are challenges in particular with kids who have special needs, kids who don't speak English, and kids who are at lower income, don't have great technology in their house. So every week we try a little harder to make sure we meet children where they are and fulfill their needs to make sure that they are learning. In particular, one of the groups for whom this is difficult are low-income kids who might not have Wi-Fi, might not have a phone, might not have a computer. And the reality is internet access obviously plays a huge role in distance learning. We've been working very hard to close these gaps. At this point, we believe we've been able to extend access to internet to nearly every household in Rhode Island. Our best guess is there's 1 or 2% that we haven't gotten to. If you're one of the 1 or 2% out there, if you're a kid or a mother or a teacher and you're listening to this and you don't have internet access and you're still struggling, I want you to call me. Call the governor's office, let your teacher know. If you're a teacher or principal, call RIDE. We are determined to get to 100% of our kids to have access to internet and Wi-Fi and a computer so that they can do their schoolwork. Right now, as I say, we think we're at 98, 99%. We are there because we've done a lot of partnering with some excellent private sector partners. A couple of months ago, I announced all households that have a smartphone with a Wi-Fi hotspot and have cell phone service from Verizon, AT&T, T-Mobile, and Sprint will be able to activate that hotspot for free. Normally it can be expensive. No activation fees, no usage fees, no overage fees. At the time, I said that service would extend to May 13th. We've gotten rave reviews. A lot of people are using it. So I want to thank those 4 providers. And today I'm announcing that all 4 of those carriers have agreed to extend that free service through June 30th. So that'll get every kid through the end of the school year. Again, I want to thank Verizon, AT&T, T-Mobile, and Sprint. It's been great work. It's been a great partnership. You've enabled thousands of kids to be able to continue their education. And for everyone out there, I want you to breathe a sigh of relief. We've been hearing from a lot of people. Until June 30th, hotspots are free. You can continue to use them. Finally, I want to make a note about basic note about equity as we go through this crisis. We have talked at length and nearly every day about our Latino community and how hard hit they've been by this virus. I want to make clear it's not just the Latino community. We are concerned with the high incidence of COVID-19 in all communities of color. And we know that it is the communities of color that are being disproportionately hit by the virus. You have asked many times, why is that? And I'm not sure we know exactly why it is. We do know that a lot of the underlying inequities in our healthcare system and in our public health system that have existed long prior to COVID-19 exacerbate this virus. And I have to give credit to Dr. Nicole Alexander-Scott and her team, who've been working for years on health equity zones, making sure that we have some basic equity in public health and healthcare delivery, so everyone, regardless of race or income or gender or neighborhood, has access to high-quality health care. And we are doubling down on those efforts now because we don't know exactly all the reasons, but why communities of color are being so disproportionately affected. But we absolutely know that one key reason is that if going into this you lacked access to primary care, you had an underlying health condition that wasn't being cared for, you struggled to get access to health care, you don't know how to go get tested, you don't have a primary care physician, it makes this worse. And so to that end, we are working very hard to make sure that we beef up our access to health care for everybody. Also testing. So we now have testing sites in the community in Olneyville, in Pawtucket, in Central Falls, in Woonsocket, in East Providence, in Newport, on the south side of Providence. We have a new rapid testing site in Central Falls in partnership with CVS. Thank you to CVS. And we're going to continue to add more of these walk-through sites and in-community sites in communities that are the poorest and that are the toughest hit. I want to be clear. We're doing a lot. We're not doing enough. So every day we try to do more. And we need to continue to hear from the community. I have a Latino advisory group who's been fantastic, bringing us the concerns of the community. We're going to expand that group to other communities. Continue to let us know what you need so that we can continue to support you today, tomorrow, a week from now, a month from now, 6 months from now. I've created an equity considerations working group. As you know, I've divided the work of meeting the needs of the crisis into different work streams. We have a specific work stream who thinks about nothing but equity, and we are going to. I am committed to doing better. We've done a lot, and we're going to do more. And I'm asking members of the community to continue to reach out to us. One simple thing you could do, as of I think about a week ago, this press conference is streamed live every day in Spanish on my Facebook page. So if you're on that Latino Facebook page, it's a great way to get comments to me. Let us know, and don't be afraid. Don't be afraid if you're, especially, don't be afraid of your immigration status. Don't be afraid to reach out. Don't be afraid about your employer knowing that you need help. Don't be afraid or ashamed. We know this is hard. We know it's hard economically. We know it's hard on your families. We know many of you live in crowded, cramped living spaces. We know it's hard to find a test. You might not have a doctor. Reach out, because I am telling you, there's more to come, and we are committed to making sure every Rhode Islander, every one of you, regardless of where you live, what country you've come from, what language you speak, what is the color of your skin, we want to help you and get you the support you need to get through this crisis.